number of people in New South Wales hospitals with COVID has jumped by around 13% today, and those in ICU is on the rise too. Meanwhile, Victoria has recorded its biggest day of cases. In both states, around 20% of PCR tests are coming back positive. We have reporters Sophie Wainwright in Sydney and Amelia Turzon in Melbourne. Sophie, to you first. So what are the latest figures?
Well, 20,794 people have tested positive to COVID-19 in New South Wales in the latest reporting period. That's up from the more than 18,000 figure that we reported yesterday. We've seen daily cases surpass this 20,000 mark 3 times in recent days, and the 7-day average is around 16,000 cases a day. Turning to hospitalisations, that's also increasing. An additional 138 people have been hospitalised, bringing that number to 1,204. That's about 5 to 6 times as many people being treated for COVID-19 in the state's hospitals now as there were in mid-December. We also have 12 more people in ICU, bringing that number to 95, and we've seen 4 more deaths in terms of testing. There were almost 97,000 tests in the latest reporting period.
And Sophie, what are you hearing about pressure on the health system?
Well, in recent days, Joe, we've seen leaked letters from Sydney hospitals, and we've heard from unions and other health representatives coming out to say that, you know, the health system is under enormous strain. There's staff shortages. There's also staff who are really fatigued, and this rise in hospitalisations is also of concern. Health Services Union Secretary for New South Wales, Cherid Hayes, says the rise in hospitalisations is becoming more concerning by the day, and he's predicting that within the next 2 to 3 months, the healthcare system will reach a critical point. When we also spoke with the Australian Medical Association Vice President Chris Moy, who says that he's been receiving quite distressing calls from doctors and other staff saying that they are really concerned, especially as they're hearing that entire teams are being wiped out because they're having to isolate because they're close contacts or they are sick. In response, the New South Wales Health has said that staff who are deemed close contacts and are asymptomatic will be able to get out of isolation and return to work in exceptional circumstances, but not all unions are happy with this. They're saying that it's a knee-jerk reaction and it's a short-term fix, others saying that they wouldn't accept this in any other circumstance. Last week, we heard from Premier Dominic Perrottet, who maintained that the health system remains in a strong position despite all of this.
OK, let's now go to Amelia Turzon, our reporter in Melbourne. Amelia, take us through the latest figures there.
Well, there's been a 20% rise in the number of COVID cases detected in the last 24 hours. For the first ever time, Victoria has recorded more than 8,000 cases of COVID, just over 8,500. Now, this comes as the testing numbers actually decline. So there's been a decline in testing from the pre-Christmas and the during Christmas spike down to 44,000 cases detected. It's unclear if this is happening because there has indeed, as epidemiologists were warning, been a spike in cases from the festive season, or if it's actually because the test results that we've had been so delayed here in Victoria are now just starting to be returned. Unfortunately, there's been another 3 deaths from the virus overnight, and we've also, just like New South Wales, seen hospitalisation rates rising, although they're not nearly as high as in New South Wales. There's currently 491 Victorians in hospital. That is a rise of 19 cases in the last 24 hours. We do know that Omicron is now the dominant variant here in Victoria, and most of the people ending up in hospital have the Delta variant, which is one thing that epidemiologists here say is a positive situation.
And what are some of those experts saying? You've just mentioned this, but what are some of those experts saying about those lower testing rates?
That's correct. So as I mentioned, we've seen the testing rates significantly decline, and that's no accident. It's because in the last 4 days, there's been a real big change here in Victoria, as of other parts of Australia, in the requirements for people to test at PCR sites like this one behind me. You now only are wanted to get tested for COVID at one of these sites if you've been with a person who has COVID for 4 hours or more in a household-like setting, or of course if you have symptoms. So that is potentially behind this dramatic decline in testing numbers. Now, some epidemiologists, they say that they're actually concerned about this situation and that not enough cases are being picked up. Here's the concerns of Mary Louise McLaws, who thinks that the reason for this tightening of PCR testing might actually have been motivated by money.
If they wanted to get the cost down, they could have done was had the testing hubs with those with symptoms in one line to get a PCR, and those with not symptoms but concern that they've been exposed with a rapid antigen test, which would have been very, very small amount of money compared to PCR testing.
Despite this lowering of the testing rates here in Victoria, there's still a lot of demand being put on the testing system here. One site that I was at this morning, it had already been telling people to turn around at 7:30 in the morning. People there were up for a 2.5-hour wait. You might see that behind me, this testing site, it's also at capacity. So it's not actually getting easier to get a test, although we have seen those testing numbers decline.
Sophie Wainwright in Sydney.